I'm most thankful to Dr. Ayman for allowing me to use some of his slides. We have got good support from Ayman Clinics. I'm so honored that all my patients can be supported, and we have got excellent resources from America. So this is our program mission. Number one, we are going to Solace Center is the Center for Brain Health and Overall Health and Success. It's located in the Rocket on the 6th floor, unit number 601 in Robina. Our passion and purpose is to help people achieve brain healthy lives in every way possible. The program is supported by myself, our clinical psychologists, and visiting mental health specialists. And I'm thankful for Dr. Ayman and also Dr. Welsh from Welsh Institute to allow us to use his methods and treatments which are scientifically proven and tested. Change your brain, change your lives and lives of others you love. By optimizing your brain, by preventing Alzheimer's disease and reversing aging. So this is the launch of the Brain Health Services. I know how hard it is. I know how hard it is for you, for your family, for your children, and the extended family that you live in, and for the community. So this is for you. So we're starting with my collaboration with my daughter and the Imagene Vitality Centre. We're going to be supported by Dr. Ayman and his clinic and his methods. Now, why must you look after your brain? Because brain runs the stock market, brain runs huge corporations, brain runs the governments, brain runs churches and families, brain runs mums and pops shop down the street, and brain runs you. Your brain is involved in everything you do. How you think, how you feel, how you act, and how you interact. And you as a person, as a parent, as a child, as a lover, as an employer or employee. When your brain works right, you work right. Now the picture on the left is the normal brain. You can see that how smooth it is. There are no wrinkles on it, very smooth. And when your brain doesn't work right, you cannot work right. And that's the picture of the abnormal brain, unhealthy brain on the right. Head injury, please wear the helmet when you are training, doing sports or anything. And yet we rarely think about the brain, which is a huge mistake. Now most foods that we eat today are bad for our bodies and our brains. Many foods marketed as healthy are bad and cause early death. Your brain is subjected to repeated fear and disaster images through everyday news. Now this is negativity, and we know that negativity sucks your memory. Addictive gadgets hook your attention, distracting you from meaningful, beneficial connections with your loved ones. Now, Microsoft, I don't know how they did it, they found that the goldfish now have longer attention span than people. How can you eat a food like that and remain as thin as her? And look at the children, all hooked up on their computers. Where's the time to love them and teach them? So you have a choice. I love the cute goldfish. I think I want to be him. Okay? And not on this side. Now, more serious side of it, Alzheimer's disease is expected to quadruple. There is no cure on the horizon despite all the pharmaceuticals are working on the drugs. It affects 50% of people over 85 years. Now, if you want to live up to 85 years, and I'm presuming that all of us want to be there, 50% of us have got a risk of developing Alzheimer's disease. It starts in the brain decades before the symptoms develop. So you may not even have any symptoms 10 or 20 years before, and you could end up with an Alzheimer's disease. That's the Spect scan of a healthy brain on the left. See how smooth and everything nice it looks, but look at the Alzheimer's brain. Now that's not the brain that we want to have. Depression is the greatest killer of our time. Very soon it will become normal. Everybody is going to have depression. Now, since 1987, it has gone up by 400%, despite introduction of Prozac, which is an antidepressant. Now, that is because since 1987, the food marketing industry has changed our lifestyle as well. Now, 23% of the women between the ages of 20 and 60 years are taking antidepressants. And the birth control pills and depression. Now, anyone's taking birth control pill, it drops your serotonin, the no worry, happy hormone. And it doubles the risk of Alzheimer's in women and it quadruples in men. The next online is the overweight. It's a national crisis. 2/3 of us are overweight, 1/3 of us are obese. Why is it important? Because it increases the inflammation. So inflammation in the brain, inflammation in the joints, and inflammation in the heart, and anything you can think of. It is a risk factor for 30 medical illnesses including cancer, diabetes, depression and dementia. And there are 200 studies which shows that as your weight goes up, the actual physical size and function of your brain goes down. Now that's scary. This should really scare the fat of anyone. And look at that poor dinosaur there with a small brain and the big body, and we all know what happened to the dinosaurs. They got extinct. Now we don't want that. Now the answer is not to see them as separate disorders. Obesity, depression and Alzheimer's, they are just different expressions of the same illness. Now which brain do you want to have? Now that hasn't come out very well, but I've got a poster for you here, and I would really love to have a brain like that. So we have here cocaine, marijuana, alcohol, and smoking. Please have a look at the brain who's been smoking. This is Dr. Ayman's brain scan. He's let me have that. Now at the age of 37, his brain was like that, with wrinkles. And at age 57, look how he has improved his brain with the methods that he has been using. Now the brain on the left is because he says that he has had a history of meningitis when he was young, and he was a soccer player, and he's a tiny man, so the big boys really gave him a hard time. They were very mean to him. But he has used his methods, and his brain scan at age 57 is definitely different. Now, no one wants to see a psychiatrist. No one wants to be labeled as abnormal or defective. But all of us want to have a better brain. What if mental health was really brain health? This is the brain activity over time. You can see the brain at age 30, age 50 and age 80. That's what happens normally. So with the right decisions and lifestyle changes, brain aging is optional. Because you can see that 82-year-old normal brain, how it looks on the left, and Doris's brain at 82 with the right decisions that she has made. So you can change your brain. Now, how many of you have got these signs? There are 14 warning signs that your brain is in trouble. If your memory is poor than 10 years ago, if you have got low energy, low mood, irritability, anxiety, stress, worry, short attention span, brain fog, you're making impulsive bad decisions, you're not able to sleep, sleep apnea. Now, sleep apnea is very, very important, something that you can really do something about it. You have been to some of you I know have been to the doctors, have been given masks to wear, and what you have done, gone home and thrown it away. Please go back and put that on, because there's 20% of the oxygen that the brain receives from you, and if you don't give the oxygen, especially at night time, when it needs it to wash away all the toxins in the brain, it's not going to be working. And it's for Alzheimer's as well. High blood pressure, high sugar. Sugar is bad. Weight issues, sexual dysfunction, again it is a cause for the blood supply, and you do not listen to what we tell you to do. It's too hard. Or I'm doing everything but I'm not achieving anything. Now, how can you do everything and not achieve any results? What have we learned? You are not stuck with the brain you have. You can make it better. Now, this is the breadths and strategies that a study that came out in 2015. He studied 10 people with Alzheimer's disease. Now, study with Alzheimer's disease, putting them on the program that I'm going to talk about later. In 6 months, 9 were better, 6 went back to work. And the one that did not get better, he had a long-term Alzheimer's disease. So early treatment works better than late treatments. And what he found that the 4 methods that he found that were useful in these patients: optimizing their parameters, so all your numbers, bloods, cholesterol, all those things that I'm going to go through with you now. Not just normalizing them, but optimizing them. Normal is not good enough, not for my patients anymore. And multiple approaches, personalized based on individualized parameters. Now that's your job. And iterative, optimize over time. Keep after it, not just do it, forget it, and then start again. You have to keep after it. So what we need to do is, what the center is going to do when you come to register for brain health services is that we are going to be doing brain screening. Now, unfortunately, we do not have Spect scan in our center. There is only one Spect scan in all of Australia. It's in Perth. But there are other things that we can do for you. But remember that the treatment works early, not late. And 95% are not diagnosed till late. This is the Spect scan, and you can see Hari having his Spect scan there in America last year. And Koshi is having hers in a couple of weeks' time. We are going to America, so she's going. So everybody in my family are going to have Spect scan. This is the test that we have. It's Web Neuro. It's a 30-minute assessment which determines a person's objective strengths and limitations in order to help the clinician make informed decisions on treatment management, especially in the fields of ADHD, depression and addiction. So it's a computerized program. And these are the things that we look for: your motor coordination, your processing speed, your attention. And one of the things that the new one that we have purchased does is the positivity versus negativity. There are some of us who want to remember the negative things, so negative faces, so sad faces we tend to remember, but happy faces we don't. Now, negativity sucks your memory, and you want to train yourself out of negativity. And we have got a computerized brain training for 6 months as well. So we do this screening and then we put you onto the training program. Baseline screening, your body mass index. Now, the first 17.5 to 24.9, 25 is normal. Now, after 30, you have 4% less brain tissue. That is 8 years older than healthy people. Now, if your BMI is 40 and above, it's 8% less brain tissue and your brain is 16 years older than healthy people. Now, that's very scary. We're going to aim to make your blood sugars below 5. Hemoglobin A1C is a very interesting one. It measures your sugars in the past 3 months and we want to get that down. We don't want you to be pre-diabetic. We want you no sugar, no diabetes at all. Lipid panel with fractionation. Now, we do all the lipids. What is important is that we have to fractionate the lipids and see whether you have got the beta particles and alpha particles. If you've got alpha particles present, that's very good, but if you've got beta particles, then that's not good and we want to treat you. Most of us are on statin. Statins are good, please check with your cardiologist, but it does suck away your memory and drops your male hormones. Thyroid function test is very important. We want the inflammatory marker CRP and homocysteine to be low. Vitamin B12, folate. Now vitamin D, my God, how many of my patients are low in vitamin D? There was a study that came out just last year from States. If all of us took 2,000 international units of vitamin D every day, it's going to reduce cancer by 30%. Now, how simple is that? You either go into the sun and get, or you take the pills, and you can reduce your cancer risk by 30%. Ferritin is very important. Now, for women, we bleed every month, so we don't have our ferritin levels very high. Very important for men. If you find your ferritin level is getting higher, please go and donate blood and get your ferritin levels down. DHEA is a hormone precursor. Estrogen. If the estrogen goes down, your blood supply to your brain and your thyroid goes down as well. So very, very important in the postmenopausal women. And our test male hormone there. This is separate from Dr. Amen's method. This is from Welsh Institute. We have found that plasma zinc, vitamin B6 and P5 are very important for memory. Serum copper, serum ceruloplasmin, whole blood histamine, now urine pyrroles and methylation status. I had not a clue about what the pyrroles were. You patients have come and taught me and made me go and search for this. What is it? One patient came in and said, I want to have pyrrole done. So what on earth is the pyrrole thing? I searched and I couldn't find anything on it. Pyrrole is so important. It's so difficult to lose weight. It sucks away your zinc and your B6, P5 and gives you poor memory. Know and reduce your risks. So if you have got a genetic risk, you got 2.5 times the risk for getting Alzheimer's disease. So know early and make changes. Brain injuries. Now, our brain has a consistency of soft butter. It is housed in a hard skull with many sharp edges. Brain is the organ of learning, loving, behaving, and everything that you do. And 2% of your body weight uses 20 to 30% of calories and 20% oxygen and blood flow. Your behavior either accelerates or decelerates brain aging. Now, why would you want to go and do high-risk activities and cause damage to your brain? See, it has got no protection whatsoever. It is looking like that and it's just sitting in the hard skull with all the ridges and sharp point. So when you are shaking or somebody is hitting on your head, you are in for trouble. So be very careful with brain injuries, and if you have been active in high-risk sports, make sure you get your brain tested and start retraining them, because it's an optional. You can make it better. It's not too late. Alcohol and drugs. Now, you're not going to like me. 2 standard drinks per week. Obesity and metabolic syndrome triples the risk of Alzheimer's disease. Cardiovascular, including high blood pressure, 2.5 times. Any stroke, 10 times the risk. And exercising less than twice a week doubles the risk. So know your risk and reduce your risk. Less formal education or job with no learning. We have to continue to do new learning to activate and stimulate our brains. Diabetes, 3 times the risk. Smoking, 2.3. Parkinson's disease, 3 times. And untreated depression, 2.5 times. Untreated ADD, 3 times. Low estrogen and low testosterone, twice, doubles the risk. Sleep apnea doubles the risk. Cancer treatment triples the risk. Now, inflammatory markers, if they are high, it doubles the risk. So we need to bring them down. Periodontal disease. Please floss and brush your teeth and see a dentist. It's a cause for heart disease as well as the brain. Now, anyone 65 to 74 doubles, but 74 to 85 7 times, and over 85 38 times the risk. Now, what's important is that when you are having your meal, you must ask yourself, what did this food eat? So, if you are eating chicken, you need to know what the chicken was fed with. Hormones, antibiotics, because you are feeding yourself with that as well. So, be calorie smart, a clean whole food, low glycemic, high fiber carbs, clean protein and high healthy fats. Now that Tana there is Dr. Ayman's wife. These are the 14 best foods. So hopefully they are on our menu. And mental exercises. New learning. For left frontal brain, you need to do crossword puzzles and word games. Now, it's not like you go to the gym and you just exercise the left biceps. You do exercise your right biceps as well. So you need to exercise both sides of your brain as well, left and right frontal. Temporal lobe, memory, musical instruments are good. Parietal lobes, map reading, puzzles, juggling, and for cerebellum, coordination exercises, dancing and table tennis. Physical exercise, walking. Bursting exercises, so you walk for 20 minutes and in between you run. And then walk and then run. They have found that this works better. And the coordinated exercises like table tennis, dancing is very good. And that's the study that came out about physical exercises and healthy brain. 20 minutes every day. Now some of us run. Running is good, but the Spect scans of the people, marathon runners and athletes are not very nice, because apparently when you are running very fast, your subconscious mind thinks, why the hell is he running? He's a human being, he's not supposed to run. He's a tiger or somebody chasing him, and that causes an extreme stress on your brain, and so the problems. Now, sleep, stress and mood. We need 7 to 8 hours of sleep. Not 3, not 4, not 5. 7 to 8 hours of sleep. Children, you listening? So get sleep apnea assessed and treated. And kill the ants. Ants is automated negative thoughts. So whenever you feel sad, mad, nervous or out of control, sit down and write down what you are thinking. Is it true? Is it rational? Is it helping me? Thoughts lie. They hurt you more than anyone can hurt you. Meditation is good, and hypnosis also they found that works. Hormonal optimization. Avoid anything that hurts hormones, belly fat and sugar. Hormone precosis and bioidentical hormone replacement has also been used in some cases. The things that decrease the inflammation, one is your diet, omega-3 fatty acids, something called sulforaphanes which is present in cooked broccoli, and I think there is a company in Brisbane which actually has made broccoli powder that works. Curry, rosemary, garlic, green tea, cocoa, and then dental hygiene is very important. Things that increase the inflammation we need to avoid: wheat, pasta, sugar, grains, bread, and high glycemic and low fiber foods. This is a bit complicated. This is something called beta amyloid reducing agents that's present in the brain. When you do not sleep, brain begins to produce a sticky, gluey stuff that when dropped into the nervous cells cause short circuits. And this is found to be a major mechanism in Alzheimer's disease. And sleep helps to clear them. When you go to sleep, brain washes itself of these substances, and vitamin D and curcumin also helps. This is another complicated one called tau proteins in the brain, and due to repeated trauma, mostly in the sports people, these tau proteins escapes and cause the degenerative changes in the brain which causes dementia. Those black spots that you can see escaping out of the brain, you don't want them out of your brain cells, you want them within the nervous cells. The things that boost our blood flow to the brain. The things that you need to avoid is stress, caffeine, nicotine, heart and artery disease, diabetes. So sugar, it makes the blood vessels brittle and they break. Environmental toxins, lack of sleep, drug and alcohol abuse. They all reduce the blood supply to your brain. The things that help to improve the blood flow to the brain is stress management, lots of water, good sleep, ginkgo, verbicity, and ginseng, green tea. Rhodiola is very good. It decreases stress and increases the blood flow. And arginine also increases the blood flow. And the specialists sometimes use the hyperbaric oxygen and the transmagnetic stimuli to increase the blood flow as well. Nutrients are very important. Remember, in the breast study, they said not one thing is going to help. So just doing luminosity every day or taking a small tablet of ginkgo every day is not going to help. You need to fight with as many weapons as you can. You're not going to win the war with just one tiny tablet or one exercise. Anti-inflammatories, omega-3s are important. Vitamins, blood flow, ginkgo and vinpocetine, and acetylcholine improves the memory. Antioxidants also to improve the memory. And to blood sugar stabilization, we use alpha-lipoic acid, and for energy, Q10 and carnitine. All my patients are very smart. They know all these things. They have asked me questions, and that's why I have gone and found out. Now, Dr. Imagene Clinic has got those compounds in one pack. So that's two size, one for in the morning, one for at night, and they've got Neurovite, omega-3 and brain and memory power boost. anyone who registered with our clinic has got a promo code that you can use, and you get discounts if you buy through our clinic. You get 20% discount, which is a discount for me. We pass it on to our patients. Dr. Welch's protocol, we need to optimize the zinc, optimize vitamin B6, minerals and vitamins. We reduce the copper, antioxidants, we support the mitochondria, we improve the methylation status, we reduce the homocysteine, which is an inflammatory marker, and we support and optimize the gut bacteria. There are lots of studies to show now that there is a gut-brain connection. 60% of your serotonin, the neurotransmitter, is made in your gut. So if your gut is not working well, your brain is not working well either. And epigenetics, that's another talk. You can upregulate and downregulate according to your genetic profile to help you. So there is hope, and we should enjoy the benefits of life and what it has to offer by living healthier, happier and longer. There are a lot of people dependent on us. We have made promises, we have taken vows, and the other children look upon us. So we need to do something. Case intake, we have a first consultation which involves 90 minutes. So we do a comprehensive history taking, and we have got different history taking for child, teenage, adult and parents. And we start the investigations and we do the web neuro assessment. The second consultation is for 60 minutes 2 weeks later, when we get all the investigations comes through. We review your history, we review your web neuro testing, we review your investigations, and together we make a plan of action. And we follow that up every 4 months. Remember, we have to keep after it. Our management plan will involve optimizing your numbers, optimizing your vitamins and minerals, improving your gut function and gut bacteria, nutrition for life, physical exercise, mental exercise, computerized brain training. So anyone who's registered for this will get 6 months of free computerized access to do their training. We will offer counseling, and you will have health coaching so that we can keep after you to maintain all the above. It is very hard. We all lose battles, but the difference should be that we must lose less battles and win more. Now I'd like to thank Dr. Ayman and his Ayman Clinic for allowing me to use his methods and treatments. This has made the service credible, as these were well tested and scientifically proven. And anyone who wishes to buy the products can go onto the site and use my discount. But the most important thing with the Ayman Clinic is that if there is a complicated case, if we need any resources, if we need second opinions, they are there for us. Now, I have a wish list for our government. If we can have another Spect scan maybe in the south, we have one in the north. And if we can change mental health to brain health, that will help a lot of us and take away the stigma associated with the mental health. That would be really, really good. Thank you, and I wish you all the best.